The Douglas County Health Department is reporting its first case of multi-system inflammatory syndrome in children, or MIS-C. Doctors believe it's tied to COVID-19. Reporter Sydney Gray tells us how the disease is affecting kids and what signs parents should look out for.
This is rare. It's in the news, but it's rare. 2, we have treatments available, and so far the children appear to be responding to those therapies. 3, it is not subtle. Your child will look sick, and you're going to use those parental instincts that you have to seek out care.
The Douglas County Health Department confirmed its first case of multisystem inflammatory syndrome, or MIS-C, a rare disease health officials believe is linked to COVID-19.
The boy was exposed to household members with COVID-19, and he himself had a positive COVID-19 test in the hospital, which could mean present infection or previous infection.
The patient, a boy younger than 12, has been in the hospital for about a week.
In this case, the individual had a fever, rash, fatigue, and abdominal pain.
Pediatric infectious disease specialist Dr. Carrie Neiman says some symptoms include fever, abdominal pain, vomiting, diarrhea, rash, red cracked lips, as well as swollen hands and feet.
Seek emergency care if your child is having trouble breathing, they're complaining of pain or pressure in their chest, new confusion, they won't wake up or having difficulty staying awake, bluish lips or face, or severe abdominal pain.
According to the CDC, the case definition for MIS-C is very specific.
It needs to be an individual 20 years or younger presenting with a fever, and the fever was specific, 100.4 degrees or more for more than 24 hours.
Dr. Poor says people must also have lab evidence of inflammation, clinically severe illness requiring hospitalization, and a positive COVID-19 test or exposure. Dr. Neiman says it's important to continue safe practices to avoid the disease.
I think we all know this. By limiting potential COVID-19 exposures, by utilizing masks when we're out in the community, by performing adequate hand hygiene, and by social distancing.
In Omaha, Sydney Gray, 3 News Now.
Well, this is the first case in Douglas County. It's the second case in Nebraska. Health officials with the Two Rivers District reported Friday a boy in Dawson County had been identified as having the syndrome.